PCOS symptom management. What actually works? Polycystic ovary syndrome, or PCOS, is a lifelong hormonal and metabolic condition. That means there is no permanent cure in the traditional sense, but that does not mean you are stuck with your symptoms. What we are really talking about is symptom management. With the right combination of lifestyle changes and targeted treatments, many women can normalize their cycles, improve their skin, reduce excess hair, and support their metabolic health. If you maintain these habits over time, you can largely live symptom-free. But just like managing blood pressure, for example, with diet and medication, if you stop those measures, the condition is likely to start affecting you again. My name is Dr. Besma Ferris. I am a board-certified OBGYN and nutritionist practicing in New York with a specialization in PCOS. Let's talk about metabolic health, and specifically insulin resistance, which is central to so many PCOS symptoms. Insulin resistance in PCOS makes it easier for the body to store fat and harder to release it. It also drives fatigue and makes appetite regulation more difficult, which is why standard diet advice often feels ineffective for people with PCOS. The most successful approach focuses on improving insulin sensitivity directly, not on achieving a specific weight. This includes a balanced diet with controlled carbohydrates, regular physical activity, and adequate sleep. When it comes to nutrition, the goal is to eat in a way that keeps blood sugar stable and prevents the excess insulin release that drives so many PCOS symptoms. The foods that do this best share a common thread. They are minimally processed, rich in fiber, and built around whole plants and healthy fats. Fiber deserves special attention. Increasing fiber intake consistently lowers blood sugar, insulin levels, cholesterol, and inflammation. And higher fiber diets are linked to reduced mortality and a lower risk of developing type 2 diabetes. When this kind of eating pattern is combined with regular physical activity, the impact on insulin sensitivity and overall metabolic function is significantly greater than either one alone. For some patients, medications like GLP-1 receptor agonists or metformin can provide additional metabolic support. The goal is not extreme dieting or a specific number on the scale. It is sustainable metabolic improvement. Excess hair growth can be reduced by lowering androgen levels and blocking their effects at the hair follicle. Hirsutism, which is unwanted hair growth on the face, chest, or abdomen, is driven by elevated androgens. Combined oral contraceptives are the most effective first-line treatment because they reduce androgen production. If hair growth persists, medications like spironolactone block androgen effects at the hair follicle. These treatments take time, often 6 months or more, to show full results. In parallel, cosmetic options like laser hair removal can provide faster, visible improvement. Long-term success usually requires a combination of hormonal treatment and cosmetic therapy. PCOS-related acne tends to be deeper, more persistent, and often resistant to standard treatments. Androgens, again, are a major driver. Birth control pills help regulate androgen activity and are considered first-line treatment for hormonal acne in PCOS. Topical treatments like retinoids and benzoyl peroxide can help manage breakouts, but they are often not enough on their own. Spironolactone is commonly added if acne is severe or persistent. In some cases, metformin may also improve acne by addressing the underlying insulin resistance. The evidence on diet and acne is mixed. Some studies show improvement with a low refined carbohydrate diet, while others did not find strong effects. Because reducing refined carbohydrates supports other aspects of PCOS management, it remains a reasonable recommendation. Irregular or missed periods are one of the most common signs of PCOS, And they happen because ovulation is inconsistent. Targeting insulin resistance is central to improving cycle regularity. Regular exercise, especially a combination of strength training and cardio, helps the body use insulin more effectively and can support more predictable ovulation. For people who experience body weight reduction as a result of these lifestyle changes, even a 5 to 10% decrease can further support cycle regularity. Though, improved metabolic health, not weight loss itself, is the primary driver. For women who are not trying to get pregnant, hormonal birth control is often the most reliable way to regulate cycles. For those who prefer a non-hormonal approach, metformin can improve insulin sensitivity and may restore more regular ovulation over time. Many women with PCOS can successfully conceive once ovulation is restored. The first-line medication for ovulation induction is called letrozole, which has been shown to be more effective than older treatments. Lifestyle changes that improve insulin resistance also increase the chances of ovulation. If needed, additional medications or combination approaches can be used. PCOS-related infertility is often very treatable with the right approach. Many women go on to have healthy pregnancies. Beyond visible symptoms, PCOS is strongly linked to metabolic health. Insulin resistance, elevated blood sugar, and abnormal cholesterol levels are common, and addressing these matters for long-term health, not just symptom control. Exercise, nutrition, and stress management are the foundation. Metformin is often used to improve insulin sensitivity, particularly in women with prediabetes. GLP-1 receptor agonists can also be effective for metabolic improvement. These interventions reduce the risk of diabetes and cardiovascular disease over time, regardless of changes in body size. The bottom line, the most important thing to understand is that PCOS management is not about short-term fixes or achieving a particular weight. It is about long-term sustainable habits with support from medications like birth control, metformin, or GLP-1 agonists when appropriate. The patients who see the biggest improvements are the ones who commit to consistent lifestyle practices and use the right combination of treatments at the right time. PCOS does not have to control your life. While the condition itself may not go away, the symptoms can dramatically improve or even resolve with the right approach. What questions do you have? Drop them in the comments below, and I will do my best to answer them in a future video. Don't forget to like and subscribe, and I will see you in the next one.